All right, there we go. We should be recording it this time. So to further empower schools and educators, the Maine Department of Education launched a 4-part series to deeply explore portions of the Maine Department of Education Attendance Toolkit. This series guides participants as we delve into specific sections of the toolkit, examining resources and strategies designed to increase student attendance. I have to give you a side note. I've been spending some time really looking at the hearing for LD 322 that is in the process of consideration with the legislature. And I have been fascinated by many of the conversations that our representatives and our senators are bringing forward. So we have some great things that are happening right now. Each session of our toolkits exploration features a content expert offering a unique opportunity for schools to ask questions and develop actionable plans for implementation. Each webinar is recorded for future access on the Maine Department of Education attendance page, and we're also looking at establishing a new MEAC website, which will house our Maine Engagement and Attendance Center work. I just want to make sure that, okay, we do have our recording going. I didn't see any lights going on there. Our first session was January 27th, and we worked with we explored the basics of our toolkit, and we kind of explored when the toolkit started, its inception, and why it came about. February 24th, we worked with examining our school climate and student supports. This month, we're going to highlight comprehensive health education and employee wellness. So this series is designed to provide targeted guidance for schools, ensuring the tools and strategies are integrated effectively into the systems you have in place and to address attendance challenges. Very quickly, we're going to start off with some introductions in just a moment, and then we're going to roll into, at about 3:40, we're going to have Susan Berry as our content expert start with comprehensive health education. About 10 minutes later, she will switch gears to employee wellness, and we'll spend about 10 minutes there talking about the why, the resources, strategies, and always throwing in stories of implementation success, hopefully a few stories that you can steal. So I am Sarah Nelson, and I've worked with members of the Office of School and Student Supports in my role as the Student Engagement Specialist for the state of Maine. I arrange professional development interactions with school personnel and community representatives statewide. I assist schools with implementation of student engagement practices, implementing DOE initiatives supporting the whole student and the whole educator. Perhaps you've seen me with some of the work at the regulated classroom, or maybe you've heard of some of our work with building assets, reducing risks, our BAR work. I additionally assist with integration of evidence-based engagement practices that align with Maine state and district strategic plans. And most recently, I've joined with many throughout the state to place the spotlight on efforts for increased attendance through our collaborative practices with the Maine Engagement and Attendance Center. I would like to introduce to you today our content expert, Susan Berry. She is the Health Education and Health Promotion Specialist for the Maine Department of Education. I have had the great opportunity to work with her. Maybe you've met her at the Winter Wellness Summit that we just had at the Samoset. What an incredible success. Susan has served in this position for over 20 years and worked in health education and health promotion for nearly 30 years. She has experience in schools as a health education teacher, a school health coordinator, and a family life education specialist. She has been a member of the Maine School Wellness Program Planning Committee for nearly 29 years and has been the coordinator for 18 of those years. Susan partners with numerous state agencies and organizations working on prevention strategies for health-related issues and the promotion of healthy behaviors for both youth and adults. She's responsible for the revisions and implementation of the Maine Learning Results Health Education Standards, which are what we're all using to guide our school curriculum. Susan is past president of her national organization, the Society of State Leaders of Health and Physical Education, and her state organization, the Maine Association for Health, Physical Education, Recreation, and Dance. She continues to serve on both boards to support and advocate for school health education, employee and student well-being, and healthy school environments. She is the perfect content expert for our work today as we start exploring comprehensive health education. And with that, Susan, I am going to pass the baton.
Well, thank you very much. I appreciate that. I'm going to share my screen. Make sure I have slides all up and ready. Y'all just give me a moment. Thank you for that introduction, Sarah. And I'm thrilled to be here and to be sharing. I'll actually start with the toolkit here, just as I told Sarah that I would do that. So hopefully you all have seen or are aware of the attendance and dropout prevention page with the attendance toolkit on it. And you can just, I think I've already downloaded it, so you can download it. Oh, let's see.
One thing to keep in mind, following our session today, you will each receive a follow-up email, and the toolkit is right on there if you've not yet had a chance to explore it. But Susan will take us through two of the pages today.
So just to show you what those look like, here is the page for comprehensive health education. And not too far down from that is employee wellness. So these will be the two pages that I'm going to be highlighting in my presentation today. And let's see if I can get that slideshow started. Oh, I did not want to go from the beginning. Hold on. There we go. I'm gonna escape. Try that from the beginning again. There we go. And these slides will be shared later as well, right, Sarah? Did you say that already?
These will also be included in the email as well.
All right.
So don't worry about taking notes. Drink in the information that our expert has, and you'll be able to review them a little bit later on.
Wonderful. Thank you. I just need to get this out. There we go. All right, folks. Again, thank you for having me. I appreciate being here to share the information. And this is a very exciting tool to become aware of. And if you have these slides, this is linked right to the toolkit as well. And this is just to give you easy access to my information. I am on the Office of School and Student Supports Coordinated School Health Team within the Health Education and Health Promotion Program. But we're here to talk about comprehensive health education and employee wellness. So starting out on the page for comprehensive health education, you'll find that there is a definition. Why does comprehensive health education matter? So health education, I am very passionate about this, is a topic that benefits both the students and the adults. But for students, it improves school attendance by design, just because we're looking at healthy behaviors, addressing mental health concerns, preventing substance use, fostering a positive school climate, teaching disease prevention, and encouraging parental engagement. All things that if students are working on those and have healthier understandings and practices and skills around them will mean that they are in school, much more likely to be in school. And because we are giving them both the knowledge and the skills, and I emphasize skills because we develop the skills that they can apply to anything that they're addressing that will help them, not just the content areas that we listed here, but any type of challenges. The skills are meant to help them with communication, decision-making, caring for self and others, dealing with influences on health. The list goes on within health education. Those are some of the skills that I just listed. And it helps them to maintain their health and well-being so that they can reduce their school absenteeism, that they can be more engaged in their learning and in their social environment as within the school. And that all is important to their learning. So within the Comprehensive Health Education Toolkit, you have a couple of different resources that are listed, plus I'm going to share a couple more with you. So we have, whoops, sorry about that. Wanted to go to, all right, I'm playing here with this. I wanted to go to the website, but I'm not having fun doing that. But there is a health education website, and you can go there. That has information for teachers, administrators, folks who work in the field with youth. So not just for schools, but for higher ed, for nonprofits, community members can access information around health education. What is it? What does it look like? What's engaged in that? Historically, people think of health education as healthy eating and physical activity, and it is so much more than that. That is just a little inkling of it. It's, again, about the skills that students need to learn to live and practice healthier lives and make healthier choices, and as adults, engage in healthy behaviors. Another tool that we have that you'll have access to is the Maine Integrated Youth Health Survey. We have been doing that in Maine for many years, a couple of decades plus. And that gives us information that is anonymous information shared by our youth and our students that tell us what are their health behaviors. So we can look and see what are the current concerns. And that is something that is important to know about, because we encourage folks in the schools to use that to guide their health education. I am including just a few more websites that I think you'll find helpful for health education. Within the health education website, there are the standards, which are linked directly there, but there are also tools that can be used to support the implementation of the standards. I would encourage you to spend some time just kind of cruising through there. That website, by the way, was designed by health education teachers with the resources they thought were very important to have there. So there are links to websites for different audiences on that webpage. We also have the interdisciplinary instruction team, has excellent resources that support learning across the board and integrates health education into them. We have Learn with Moose, which has health education standards addressed within the modules. Some modules are even focused on health education, which is great. And educators can use those for remote days, for learning in the classroom, for extended learning for their students. And of course, we have our social emotional learning webpage, that those tools that can be found there align directly with the standards for health education and the skills that we're looking to develop with students. There's a very nice cohesive sharing. And I would be remiss if I didn't mention the US CDC's Mental Health Action Guide, which was released in December of 2023 with additional resources in March of 2024. And that includes a piece about the importance of comprehensive health education to addressing mental health in the school setting. Also in the toolkit, you'll find strategies for health education and how to implement health education. I mentioned just briefly before with the MIAS data, reviewing the data is a really excellent tool for honing in on what are the issues that are most important within a school system, within a school area within school, a county, a public health district county, or looking at the state and nationally, how do different areas align to that? So if people are saying, well, what should we be focusing on within our health education curriculum? We're developing skills, but what content are we going to use to teach those skills? Well, if the data says you have a high percentage of your students that are vaping, for instance, then definitely we need to spend a little more time maybe addressing that. Or if they have an area that binge drinking comes out as a high issue, or there seems to be an uptick in students engaging in sexual behaviors, then that helps to kind of redesign or redirect where the curriculum might want to be focusing. Again, it's skills-based, skills that cross-cut all content, but it helps to say, well, let's use these areas to teach our skills and help to reduce some of the issues. I met with some teachers just this month at a professional learning opportunity, and they were talking about how they use the data to inform their students about what's happening in their area. And they use it in a way that the students get to engage with the data. There are fact sheets that are on the Maine Integrated Youth Health Survey website, and those fact sheets are very conducive to using with youth. And what they can do is say, so, they can actually talk with students about, so what do you think the numbers say? And the students will give that out. And what they find is they aren't nearly as high as the students think. So having the students look at the data, they may say, oh, like 85% of kids are doing it in high school. doing it, so having sex might be the topic, or maybe it's using tobacco or binge drinking, when the data may show them very different numbers and more of a realistic viewpoint. So using the data is important in knowing what's happening. Clearly, with health education, we're talking about preventing illnesses because the practices that they learn, the skills they learn. COVID was a great example of we really ratcheted up. What are the practices and behaviors that will reduce any type of illness, not just COVID, but other types of illness? And what do we need to know about that? And it also can help them to learn what are some of the myths out there. So what are the facts they need to know versus the things that people think or want you to believe. And then promoting prevention across the board. The skills, again, going back to the skills, are about learning healthy behaviors and staying away from unhealthy behaviors. So how do we say no? How do we practice not getting in situations, unsafe situations? How do we help others when they tell you that they're feeling hopeless and helpless? How do we help our friends? Who do we reach out to and talk to? Those are prevention skills that are taught within health education.
Susan, I love the idea that you're stressing of data, or data. But either way, it's something that we keep talking about. You cannot move forward unless you know your foundation and where you're coming from. So that's a great point. Thank you for always bringing that to our mind.
And it's not just for the adults, it's for the youth as well, for them to understand this is really the true data that we're talking about. This is not just the hearsay that's out there. And there are different sources of data, not just Maine Integrated Youth Health Survey, but that's one valuable, but there are many others that are valuable as well. And again, I could tell you countless stories of working with prevention and teachers. I had a teacher recently say to me, she had students come into her classroom. They'd already gone through health education and they came back to her classroom. They were having relationship issues and they needed her help. They needed to talk out what was going on. They had learned that skill in her class, the importance of doing that, and sometimes having to pull somebody in order to help them understand what the other people were thinking and going through. What were the stresses in their lives that they were dealing with, and how could they best help them? So we hear that over and over, stories of they learn their skills and they put them into play. So that's what we want them to do up through the grade levels.
So Susan, one of the cool things about that is at the end, again, with the email that people will be receiving, they will have your contact information. They can always reach out to you for specific stories of implementation success. If people have a challenge, Susan is the gal to chat with. She has so much experience in this.
And one of the things I think is really important is finding out what's happening for health education in your school districts. Where is it being taught? What grade levels is it being taught? The Maine learning results, which you have the link to, and the law states that it is to be covered kindergarten through high school, through graduation. Is it? Is it in all the grade levels? We know that if we can build the foundation at the elementary level that feeds into the high school, feeds into the middle school, then feeds into the high school, we have much higher success rates with students learning and implementing the skills, and we can expand the amount that they teach. If they're missing middle school health education, that's a huge learning gap for them. And that will impact their attendance because they will not have the skills. More students will have been dealing with life-altering, real-life situations that they may not have realized things that could happen to them or how they could prevent something if they're not getting the knowledge and the skills to help them through. So it really can have an impact on the being there. We want that positive role model, the health education teacher who can help them, as well as the school counselors and the school nurses who are part of that team. But having a health educator dedicated to addressing mental health, physical health, social health with our students and helping them to learn the skills to move through is so important. And students will be more present when they are healthier and feeling safe and less stressed.
So Susan, you could not have done a better segue to our next section, which is employee wellness. How do we have those positive models? What can we do to support employee wellness? And so we'll spend about 5 to 7 minutes going over this now. Thank you.
Yes. And I'm just setting my timer so that I'm staying on task here.
It's so hard, isn't it?
Yeah, so much I could tell you. So employee wellness, it's so important. And though it's been important for decades, I think in the recent years, it's even risen higher to the top. We need to take care of our employees. We need to take care of the adults so they can take care of the students in their charge. And when I talk about the school employees, I'm talking about all employees within a school district, not just classroom teachers, but those who work in food service, in the main office, in the central office, those who are the face of the school nurses, the counselors, the people everyone who engages with the students in the school. It's important to be taking care of them. Bus drivers are part of that, custodians. So school employees who embrace healthy practices and model positive behaviors and attitudes for students will create a more inviting atmosphere for students. They'll want to be there. They'll want to be present. Promoting the overall health of the school employees also helps to support student health and academic success. We know healthier students are better learners, and those in a healthier environment are more likely to show up and be more engaged in their learning. So individual schools or districts may wish to review and look at their local attendance data to determine whether staff well-being may be influencing student attendance. What is morale like? What is the attendance rate like among the staff? And that data is available. Some of the resources where folks can look for employee health promotion and wellness, our website that we have at DOE, which is a program that I work with, which is the Maine School Site Health Promotion and Wellness Program. And we have professional learning opportunities. As Zara talked about, we had at the end of January, our Winter Wellness Summit. We have also offer webinars occasionally, and we have monthly community of practices for wellness people to come together and talk about how to promote health promotion and wellness within our schools for both staff and students. Because we know, again, whatever we do with the staff will help the students as well. And sometimes we have student wellness programs as along with that. And then we have the CDC Employee Wellness Program. They have a great toolkit that is available and information that is available. By the way, I did update. I have the correct link on my slides. It needs to be updated on our website, Sarah, just as and that's only because CDC, it's only because CDC archived their materials. So that happens. Okay. Yeah. In addition, I did add not this exact same link, but it's the Maine DOE Health Promotion and Wellness resource page that's off of our website that has a list of, oh goodness, there must be about a dozen different employee health promotion and wellness sites that people can utilize. One of the newest ones comes from the Society of Public Health, which includes school health, and they have created a new wellness, employee wellness toolkit with funding from the US CDC. It's an excellent toolkit. I encourage you to check that out. And of course, our social emotional learning and emotional intelligence website that we have is not just for students, but it's for staff as well, and has tools and resources to support everyone. The Regulated Classroom Initiative is so important because it dovetails beautifully. It is together. It's about how do we regulate ourselves as adults in order to better support our students, and that's what we want to have happening. We want students to feel good about coming to school because they feel a positive energy from their educators, from the people they see in the hallway, the people they see in the cafeteria, on the bus. They're greeted with a smile, with someone who wants to help them and support them. So we need to be providing those resources and supports for all of the adults in order for students to feel, I want to come to this place. I want to be taken care of. I want to feel the love from the moment I walk through the door or get on the bus, that it's a positive environment. And that's what, that certainly the Regulated Classroom supports that. And the US CDC Mental Health Action Guide, again, talks about the importance of taking care of the adults in order to better take care of our students. And we hear, again, I hear stories all the time from the field about when they have these programs in place for the adults, and they have policies in place that are inviting for the adults to be there, that they feel cared for, and it's a place they want to be, then they want to be there and they want to help more. So having a wellness team in place at a school district makes people feel invited. Getting a message in the morning from the wellness team, from the administration, that says, welcome, today is a great day because, or did you know today is this such and such a day, so enjoy this. Those little things make such a difference. Walking into the building and have it being an inviting building from an aesthetic point of view, going into the adults, it used to be called the teacher's lounge or teacher's room, but the adults room that they can go into, and maybe somebody put flowers in there or has a corner of the room available for someone to just go sit by themselves, and they know it's a designated space. Somebody just had a rough time for whatever, they just need to go sit for 5 minutes in this quieter corner of the room and not listen to what other people are saying. Maybe put on a headset and listen to some music. Those are little things like that can make a huge difference in how people feel. Having healthy drinks available versus unhealthy options can make a difference. When you have feeling like you belong as a part of an entire group, when you have staff meetings, having healthy snacks, as well as maybe the sweet treats. But for those who can't have the sweet treats because they have health issues, isn't it nice that they have a healthy option available so they feel included? So the little things like that make a huge difference with folks.
So Susan,
So I
I love
probably
that
jumped
you're
a little bit
focusing on
ahead to
that.
strategies. Actually, I've already kind of covered some of those.
Yeah, but you were talking about, so often we think only about the students, but really this is an extension of some of the things that we're already doing for students, but really, really noticing the employees and welcoming and greeting, and as you said, feeling like part of the team.
Having the administration welcome, say good morning. We talk about saying good morning to our students as they come in and how that invites them in. Having the administration say hello and give somebody a smile each day makes a huge difference as well. So yes, fostering that feeling for the adults to feel good and having that supportive environment, asking them what what the adults want to feel like it's a positive thing. I worked with a couple of different school systems where the employee said, if we could take 5 to 10 minutes to go for a walk in the middle of the day without being penalized, it would clear my head for the afternoon, the rest of the day. If we could have that small little policy that says, yes, you can do that, makes a world of difference with how somebody feels. They don't feel so trapped into the building all day long. They can get some fresh air. Little things like that make a difference. So providing training, allowing folks to go to employee health promotion and wellness, allowing them to come to our winter wellness summit where they can get a boost of, oh, this was great. I really enjoyed participating in this activity. Everything we do at the winter wellness summit can be replicated back in the school district, whether it's having somebody come in to do massage once a week or once a month. The employees pay for a 10-minute massage, but it's there and available on site, and they know that ahead of time. Creating an environment that just allows people to take the time to go and get what they need to feed their souls, some social emotional skill building. And then honoring teacher attendance, having a program where the teacher attendance is recognized. If people are ill, they need to stay home, and that's appreciated. That's what you need to do. But having a policy in place that says, if you're here when you're healthy and you're serving and you're doing your job, we're going to have an incentive program for that. And I've worked with a number of superintendents that have done that over the years, because we know that when the staff is there, the students are more present, they feel safer, they're not with strangers, and they want to be there. So some kids, if they know there's a substitute for the day, they won't be there the next day because they just don't feel safe for some reason. So, and I'm probably
Susan,
going to end on
we
that.
could talk for hours. There's so many great ideas, but what we'd like to do is kind of, just so that this can be a little bit more interactive rather than just to sit and get, we're going to break into some smaller groups, and we're going to ask people to take a moment and share some of the things that are working in their schools. Again, this is an opportunity for you to share what's working and kind of steal a few ideas. Maybe take about 5 minutes to discuss what steps has your school taken to develop a platform that cultivates knowledge and skills to maintain health and well-being. When you finish that up, then I'm going to encourage you to then switch your conversation to talk a little bit about here. How is your team fostering a culture of wellness? Like Susan said, are you providing 5 minutes in the middle of the day? Is there somebody that could jump around and cover classrooms so that teachers could just take that 5-minute break, go to the bathroom? You know, sometimes we get there at the end of the day and realize I've never even gone to the bathroom.
Are you doing regulated classroom activities in your staff meetings?
Exactly. When we come back together, I'm going to ask you to just place one idea in our chat that people could then use in their school. So we're going to break into some small breakout groups and then share our ideas. I'm not sure. I think that it didn't. Okay. I am going to. Can you see the breakout rooms yet, guys?
I can.
You can see the breakout rooms? Okay. I'm inviting you to join your room. And then we'll come back together here. How about, let's say, at 4:20? Come back together at 4:20. I'll see you in a few minutes. Thanks. So I'll start our recording back up again. And as I said, I'm going to invite you to summarize one step that you feel could help promote comprehensive health education or employee wellness, and just drop that into our chat. As we're doing that, I'm also going to invite you to think about any wrap-up questions you might have for our content expert. Miss Susan Berry will snag her knowledge as we have her here to ourselves for now. Taking a survey of staff to gauge their interest, definitely. And what we find, Nicole, is from district to district, interests really are varied. I heard one school talking about having a paint night. Some schools would love that. Some schools, maybe not with this current staff. Advocating for health education at every grade level. Oh my goodness, yes, yes, yes. Wouldn't that be grand? I heard other schools talking about a fall fun night. What a great way to bring people together, like a penny carnival. I've heard of that. March Madness brackets with staff favorite fruit. Oh, that's fun. I did just hear of a librarian that was using March Madness to highlight Chickadee Book Awards. And they had it posted in their gymnasium on the wall. That was quite a lively way to get the kids engaged there. The wellness teams, definitely, yes. If you have not had an opportunity to create one yet, I heard a principal, I loved the idea. She said, I think 10, 11 principals in a 12-year period, and she stepped into a role and just felt that the team was really disjointed. And one of the ideas they did was, hey, let's do a little bit of bowling and some burgers. Well, I made up the burger part, but she said dinner and bowling. What a fun way to bring people together. So thinking about those ways to, yes, utilize PTA or boosters, supporting the family engagement. Often we can tie that to Title I funds, bringing families in. Some people have been doing, at a local school I was just at, they are having a chili bake-off and math games night. Can you have more fun than that in one small space? I think not. So yes.
A very popular activity where the PTAs and a wellness team would get together is to do a like the end of the winter cabin fever event at the school. And so partnering with together is great. So you have, again, it's a family, it's the staff, it's the students, everyone's together.
I love it. I love it. And you know, Susan, it's funny, no matter which hat you and I are wearing, or any of us are wearing, it really keeps coming back to connection, community, relationships, mattering. I'm being seen. And I just keep thinking about that. How can we do
And,
that? Ooh,
and another thing I would say that I encourage all wellness teams to do is to build on the strengths of the people in your school and your community. So, for instance, if somebody's talking about, oh, wouldn't it be fun to do yoga? Does somebody in your on your staff teach yoga? Does somebody in the community teach yoga that's willing to come in and do a class? So, using those community resources to help meet the need. Also, like I mentioned something about having just a positive message every morning. Who might want to do that? For some people, that to be behind the computer, sending out that message on a daily basis, piece of cake, easy. They love to do that. For other people, it's like, don't ask me to do anything on the computer. So you want to utilize those strengths and get that message out.
so
And
I've seen some people do it over the intercom in the morning. So those people that are not interested in a computer, take a short piece of the morning announcements. What a great
absolutely.
idea. Snacks and treats for teachers during parent teacher conference nights. I've seen the um, food service team pitch together and make cookies for the teachers and then leave them in the teacher's room for parent teacher conference night. I love it.
And they
Yeah,
also could throw in and do the fresh veggies, a charcuterie boards and
that's
have
what I
those
meant, Susan.
available. I
That's
knew
what I meant.
that. Well, we have to have a little cookie too, but a little both.
Mm. Well, I so appreciate people popping these ideas into our chat. As I said, we will have a follow-up email that will have the recording. It will have a copy of the toolkit. It will have all these ideas that you've placed. It will as I said, it will also have a connection to Susan's slides and the links that she's provided for resources.
I
I can,
apologize. I found out that there was a black bar across my screen. I learned that that's the Zoom thing, so it won't be on my slides.
we'll make it'll be mint by the time it gets transferred. Emily Poland shared with us that if you minimize the participants, it kind of hides that a little bit. So Susan and I both learned something. We decided that by the time we're experts in this, they'll probably change the format. So again, I cannot encourage you enough to connect with Susan Berry. She is a wealth of information. As I said, she has been for 18 years the coordinator for
Yeah.
the winter wellness, and that those of you that were able to join us for that, holy hot diggity dog, what a time! What a
And if
time!
you didn't come this year, then look for it for next year. So,
Yeah.
so I appreciate all of you being here, especially on a snowy afternoon. And it's nice to see your faces and some familiar faces. So thank you.
Any last questions before we sign off? Well, then,
Yes.
how about 2 minutes for yourself to go out and make snowmen?
I'll stay right here if anybody has a question.
Thank you for joining us.
Thank you.